properties, and even though their intent is to keep it the way we know things would be different, it is very important that we keep Inglis House as a wheelchair community, which represents over 150 years of progress to make everybody feel and to be proud to be in the wheelchair community that gives you your independence. What if you want to live here, or give you a total independence when you can get back onto the road. This is the process of us keeping this as a wheelchair community and not a nursing home. I do repeat, not a nursing home. So what this whole matter is about, I'm Eric Tate, and I'm one of the peer members and vice presidents here at Inglis House. And what we're in the process of, we're petitioning to actually save Inglis House from being brought over from a all-profit company, because we're a non-profit, but because of funds that were mismanaged is the reason why we have another company that's coming in that's for profit only, which also means a lot of our monies will be delegated in a different way without our understandings or without our parents or families' permissions and stuff. It's very important that we want to get this message across to save Inglis House, because it has over 150 years tradition for being a wheelchair community and not a nursing home.
My name is Linda Litton. We're here out in front of Inglis House. We're trying to stop the sale of Inglis. We would like the Attorney General to look into the management of the monies. For Inglis, we would like to request a forensic audit of Inglis and Trico, the company that Inglis is trying to sell us to.
The management team has been saying is that healthcare costs have been far exceeding what they've been receiving as far as our care. But they've been saying that with the circumstances that we now have an endowment of $240 million, which has been given to the charity over the past 150 years that this place has been in existence. And they want to sell us to a private equity firm, which quite clearly is going to come in here and balance the budget. I think last year they overspent by about $10 million. So we got to cut $10 million out of a $50 million budget. The only way that that's going to happen is if they cut care levels. The company Trico Partners has purchased other care facilities, and from what we've seen in the news, those places that they purchased, the care levels go down so much that the residents there really suffer. More bed sores, more hospitalizations, more deaths, and clearly we don't want to have that.
Hi, my name's Emily. I am a former employee of Inglis House, and I'm out here to support the residents because they are my friends, and I believe that they have the right to have a say in their own destiny, and they have a right not to be sold for a private equity firm. Private equity firms show the worst outcomes for nursing home patients compared to any other for-profit. In fact, 6 months after a nursing home is sold to a private equity firm, you can expect a 10% increase in mortality and a 30% increase in hospitalizations. So we are fighting this sale for them.
My name is Christopher Hinchy. Been a resident of a facility called Inglis House for 5 years now. It is very unique, and it's one of its only kind modeled in the U.S., or at least on the East Coast. We are an independent living wheelchair community. You want to explain it easier? It's a college dorm with nurses as RNs or RAs and CNAs. I can check out with security, check out with my nurse, and go out about my daily life, and then come and go as if I was living in an apartment by myself, except there's medical care. The board right now is trying to sell us to a private equity firm, not even a main healthcare industry, a private investment firm, and they want to take the apartment buildings that they collected donations over the past decade and a half to buy and build 4 apartment buildings. They want to then become a for-profit company and profit off the apartments that they got tax grants on. There are people here that need this model to remain the way it is. We are not a nursing home. We are not an elderly care community. The board has flat out betrayed us. They're talking about money not being there. The CEO currently is making $395,000. They have betrayed us on every level. We need your help. Call the Attorney General Shapiro at 877-888-4877 and ask him to audit Inglis and audit Trico. They are betraying us, and they are trying to walk away with $280 million that was left aside for the residents and wheelchair-bound people of the community, and they want to take that to their for-profit company. The reason is when you're nonprofit, you're held accountable and you have to present what you spend money on. If you're a for-profit company, that money is able to be used at your own discretion. That's not their money. That is money meant for people in the wheelchairs and disabled people in general.
Conrad Jones. I was stricken with MS about 10 years ago. At that time, I was assistant to the president and vice president at Temple University, working with Peter Lee, of course. MS is a shock to anybody's mind, body, and soul. I came here to understand my disease, understand how to cope with it, and understand how to be a more active citizen. And English taught me that. I was at 2 other facilities before I got here. I don't want to tell you how bad they were, but they were terrible. What impressed me when I got here was the level of service, the level of personal interaction, the fully equipped gymnasium that allowed us to work out. One of the lessons I learned about MS is you have to keep your weight down and your strength up. Otherwise, the disease will take you over. And they have all those things here. And we have private rooms. And I've been in situations where I did not have private rooms. I don't want to tell you those stories. And we have a yard in the back courtyard with trees where we can go out and be together and talk and act like normal human beings. This is a wonderful facility, and it's a miracle that has been here 150 years serving people with handicaps. Thank you.
This is very important, and we want to get this message loud and clear across all the social media sites. We also have a page up on Facebook where it says Save Inglis House, Inglis House and Friends, that we can notify people. You can sign the petition. You can donate, whether if it's $5 to $10 to $20, and sign it. But it's very important that we get this message across and let everybody know what's going on down here at Inglis House.